Hello, everyone. Thank you for joining the webinar today. We'll get started in about 1 minute. Good afternoon. Thank you all so much for taking the time this afternoon to join the webinar to kick off the HPV Vaccine Quality Improvement Project with the Illinois chapters and Wisconsin chapter of the AAP. This is Drew O'Rourke, and I am the manager of prevention programs here at ICAP and the manager of this project. We're very excited to launch this activity today. Before we get started, just a few housekeeping items. Everyone on the line is muted. There are a lot of you on today's webinar, which is fantastic, but I'm just going to keep you on mute to avoid any background noise or feedback. If you have any questions throughout the webinar, please feel free to enter them into the chat box or question box. And at the end of the presentation, we'll have time to go through those and I will read them and respond. Lastly, this webinar is being recorded for those that couldn't join live, or if you would like to go back throughout the project as a reference. It will be posted to the course page on the ICAP Learning Management System. Thank you again for joining, and I will now turn it over to Dr. Mala Mather, one of the lead pediatricians on the project.
Good afternoon, everyone, and welcome to the first webinar for this HPV Quality Improvement Project. We are really happy to bring this project to pediatric providers through a collaborative effort of the Wisconsin and Illinois chapters of the American Academy of Pediatrics. My name is Mala Mather, and I'm a clinical associate professor at the University of Wisconsin School of Medicine and Public Health, and also a practicing pediatrician at UW Health in Madison, Wisconsin. And Dr. Raj Nayak is also helping to facilitate this HPV project and is a practicing pediatrician at Gunderson Health Systems in Onalaska, Wisconsin. And I also want to thank the staff for their work on this project. Drew O'Rourke, who is the project coordinator and will be managing this project, along with Kia Labraki, the executive director for the Wisconsin chapter of the AAP, and Jenny Pinkwater, who is the executive director of the Illinois chapter of the AAP. This grant was developed by the Illinois and Wisconsin chapters of the American Academy of Pediatrics with grant funding from our national AAP. And in today's webinar, we'll be detailing the objectives of the project requirements, and the timeline. We'll also go over data collection for the project and concrete next steps of what you need to do to get started with this project. And as a reminder, 5 credits of CME are offered for this project, along with 20 Part 4 MOC credits. So now I'll hand this over to Dr. Nayak, who will review the grant objectives, project requirements, and timeline.
Good afternoon. So I'm going to review the major learning objectives today, and these 3 major learning objectives will correspond to the 3 educational modules that'll be part of the program. And within each educational module, there will be some more specifics on the learning objectives. But the major objectives for this program will be to review critical information about HPV disease, about the vaccine, and about current vaccination rates for HPV. We want you to learn how to use quality improvement techniques to improve your HPV vaccination rates in your clinical practice using PDSA cycles and the model for improvement. And we want you to be able to understand the three major categories of barriers to receiving HPV vaccine and how to overcome these barriers using evidence-based practice and quality improvement changes. Next slide. The timeline for the program, obviously today is the kickoff to the project, and today, in addition to sharing with you this timeline and some of the basics, we will have some time for questions after we're done with the presentation. The week of June 18th, there will be a questionnaire that we need you to complete. We hope that you will view the educational modules which are posted on the website, review resources, and enter your baseline data. On July 12th, we'll have the second webinar, which will be to review the baseline data and discuss quality improvement tips and tools and share best practices. The week of July 16th, we'll be entering the cycle 1 data. The week of July 20th, you will enter cycle 2 data. And then on August 30th, we'll have a wrap-up webinar to discuss final results of the project and to discuss any lessons that you've learned along the way. Finally, in September, the week of September 3rd, you'll complete your project evaluation. For project credit, you will be able to get 5 CME credits, which you can claim through the Illinois chapter, you can claim your CME credits through the chapter for which it was approved, and also the project's approved for 20 Part 4 maintenance of certification points by the American Board of Pediatrics. The project requirements include completing the questionnaire, the 3 educational modules, and 3 webinars. All of the webinars will include time for questions and answers with the faculty and staff. The webinars will be recorded for those that are not able to attend live. And you will also be required to complete all 3 data collection cycles, which the timeline was already outlined, and complete the project evaluation at the end of the program.
Thank you both. This is Drew again, and I will be walking everyone through some screenshots of the ICAP learning management system to help familiarize you with the system and assist you with going through the project. ICAP's learning management system was implemented by the chapter in 2016 and has since grown to house many different types of courses, including CME modules and projects approved for parts 2 and 4 MOC. The platform is interactive and intuitive, but I think it'd be helpful to walk you through some screenshots just to give you an overview of the process. So the first thing you will do, as we talked about, is complete the brief questionnaire to give project faculty and staff a better understanding of who you are, where you are, your experience with QI, things like that. The questionnaire can be found on the main course page on the ICAP LMS. You'll just click right here, and that will open up this page where you will then select answer the questions and go through. I think there are 11 questions in there, so it shouldn't take you much more than 5 minutes. Once that is done, you'll see this page to submit the questionnaire, and that will be submitted. To continue on, click continue, and that will bring you back to the main course page to go through the educational modules. The modules, there are 3 of them. The first one is HPV vaccine, addressing safety and efficacy. The second is using QI techniques to improve HPV vaccination rates. And the third is overcoming barriers to improve HPV vaccine rates, tips and tools. The objectives are listed here to give you a better idea of what the modules include, and they will be an excellent resource to guide you through this project. So to go through the modules, you'll start with module 1 here on the first tab. And to view each module video, you'll select the lesson, select play on this page. And once the module is complete, you'll just click on this button here to return to the main page. Please note that whenever you are in the LMS in the course, you can always navigate back to the main page by clicking up here in the upper left-hand corner. That will always take you back to the home page if you need to reorient yourself. So the big piece of the LMS that we'll be using is entering data. So before we get into the screenshots, I wanted to share with you the quality improvement measures that we're using for this project. The measures will apply to patients ages 9 through 12, greater than 9 but less than 13 years. The 4 measures we will be tracking are HPV dose 1. Is there documentation that the patient received dose 1 of the HPV vaccine series, dose 2 of the vaccine series, a Tdap vaccine, and a meningococcal vaccine? So to enter baseline data, you'll pull 10 charts that fit the criteria, which are patients ages 9 through 12 seen in the past month. And you'll answer these 5 questions for each chart. The first question is the patient age, and the next 4 questions are those data measures. So to begin entering your data, you will go to the bottom tab of the course page in the LMS, Quality Improvement Data Collection, and click on this link. The first question on each page is the patient age, which will be a numerical answer, age 9 through 12. And the next 4 questions on the page will be those measures, yes or no answers. Each page within the quiz, it applies to 1 chart. So you'll answer 5 questions on each page and then move on to the next page to answer those same 5 questions for each additional chart, for a total of 50 questions for that data cycle. So you'll see down here, here's where you enter the age, here's where you enter respond yes or no, and here's where you move on to the next page and next chart. When you have entered all 10 charts, you'll select finish attempt. You'll want to go through here, please, and be sure that answer saved is written next to every question. It's very hard to go back and change data once it's been submitted, so please ensure that you've responded to every question before selecting submit all and finish. And you'll have to select submit all and finish twice to really confirm that you want to enter your data. Once that's done, you'll see this page which confirms that you entered your cycle of data. It includes the date and time and how long it took you, which is helpful information for project staff to have. And then you are done with that cycle. Between your data cycles, work with your practice to implement PDSA cycles to improve vaccination rates and ensure that all the QI measures are being documented in patient charts to make it easier when you pull them to enter data. Module 2 really dives into QI work and PDSA cycles, so you'll have a much better understanding of what you can do in practice after you view that module. And please note that on webinar 2, we'll really dive into QI tips and tools and best practices as well. So you'll have plenty of QI information over the course of the project. So when you return to enter your data cycles in July and August, the July cycle is due by July 20th and the August cycle by August 24th. You will again pull 10 charts of patients ages 9 through 12 seen in the past 4 months, and then you'll log back into the LMS, navigate to the HPV vaccine QI project page, and you'll again go down to that bottom tab to enter your data. It's the same process every time. The only difference is that it will be called next attempt versus attempt now. So please note that on the LMS, cycles are referred to as attempts. So every time you come back, you'll be entering your next attempt or your next cycle. So you'll do this, you'll select next attempt and then go through and enter all of your data for cycles in July and August. Once After every data cycle is entered, staff and project leads will be reviewing the data to take a look at aggregate progress, see where people might need assistance, and to really see where we're going. And then at the August webinar, we will go over where we started and where we got to, and also go over ways to maintain that momentum in practice after the project has ended. So in terms of next steps, between today and next Friday, we ask that you please complete the participant questionnaire. If you have not already done so, register for the July and August webinars. Those links are on the main course page, and they were also emailed out yesterday. If you don't have them, please feel free to email me. We ask that you view the 3 educational modules and review the resources document, which has a number of resources related to HPV and QI that I think will be very helpful during this project. Enter your baseline data by next Friday, June 22nd, and then work with your practice to implement strategies to improve vaccination rates. All right, that is it for the content of the webinar. If you have any questions, please type them into the chat or question box, and I will be able to answer them, as well as our pediatrician leaders. If you do have issues with attending the webinars live, they will be recorded and archived. In terms of data collection, if you aren't able to meet the deadlines, please just shoot me an email and I can work with you to enter data the following week. We really want to stick to those timelines as best we can, but obviously it's summer, you're all very busy, things come up. So if we need to, if you need to enter data a little later, we can work with you on that. I have another question asking about if we'll get reminders for each step. Yes, absolutely. I will be emailing the group before every data cycle is due, and will also be available to respond to any questions as you go through the project. How many patient charts in total will be reviewed for this project? 10 charts will be reviewed during each data cycle for a total of 30 charts. One question that has come up is if you have not seen 10 patients in that month, you just pull the number of charts that you have seen for that criteria and enter all of those charts. Mal and Raj, this question might be better for you. There are questions around offering the vaccine at age 9. If you can respond to that, why we selected to choose 9 through 12 as the age range.
Sure, I'll answer. So the HPV vaccine is approved down to age 9. There's no disadvantages to giving it at that age, and in fact, the immune response for the HPV vaccine is actually more robust for the younger patients. And practices that have started immunizing patients at age 9 have more opportunities to complete the vaccine before age 13. So there are a number of practices that have started to immunize their patients routinely at age 9 rather than the more traditional age of 11 to 12, and have had benefits in their overall vaccination rates. So we're allowing the whole age group to be measured, since some are certainly starting at that age.
Great, thank you. Someone asked if these questions will be archived. Yes, they will. I will be creating an FAQ document based on these questions and any other questions we expect to come up during the course, and that will be posted on the course page. Someone has asked for the website address. Yes, it is icap.remote-learner.net, and I will also send a follow-up email to this webinar with that link. A clarification around the data collection timeline. I believe I misspoke and said 4 months. I apologize. The data collection cycles are every 4 weeks. So I apologize if I misspoke at some point. The data collection cycles are every 4 weeks. Again, yes, if people are traveling or have other obligations and will have trouble meeting the deadline for data collection, we can work with you to submit your data a little later. Just please shoot me an email at dorouke@illinoisaap.com, and I can work with you to enter your data. Again, if you have any questions, please feel free to enter them into the question or chat box. And please know that I will be available throughout the course of the project via phone and email to answer any questions. And our pediatrician leaders are also available to answer questions related to the measures and the QI process. One question, how many questions will be required per chart? There is a total of 5 questions per chart, the patient age, and then the 4 measures, for a total of 50 responses per data cycle. I'll give people a couple more seconds to enter any last-minute questions. And again, as I said, I will pull everything that we talked about today into an FAQ document and post that to the course page just for you to have as a reference. The slides will also be posted on the course page as a reference, and for those who couldn't join us today live. One question, if we saw more than 10 patients in a period, do we use consecutive 10 or choose any patients? Please select just a random sample of 10 charts that meet the criteria. Mala and Raj, there are some questions around Tdap and the meningococcal vaccine. They're not typically given at age 9, so just questions around how that can be measured. Do you have any response to that?
I can respond to that. So yeah, I think we're just looking to record the data for those ages. So we typically give those at 11 to 12 in our office, and so it's not expected that you would have Tdap at age 9, but we're looking to record the information about the HPV vaccine, but also comparing it to Tdap and Menactra. And what we found is that through these collaborative projects, when we increase vaccination rates for HPV vaccine, we tend to also increase rates for Menactra and Tdap. So we're just collecting data on that, knowing that we don't give the Tdap at age 9.
Thank you. Again, in terms of the criteria for chart selection, we ask that you pull 10 charts of patients ages 9 through 12 seen in the past 4 weeks for each data cycle. I'll give folks a few more seconds to type any questions in. Again, my contact information is available on the screen, so please feel free to reach out with any questions that might come up, or if you have any issues navigating the system as you go through the modules and data collection, I am available to provide any sort of assistance that you need. And I don't see any other questions coming in. Someone asked about the webinars. Yes, they will all be held from 12:15 to 1 p.m. on today's is June 14th, and then July 12th and August 30th. All will start at 12:15. All right, I think that is it for questions. Again, thank you all so much for participating in this project. We are very excited to get started. It's a wonderful collaboration between our two AAP chapters, and we thank you for being a part of it, and we will be in touch. Thank you all so much.